Well, hello everybody. Thanks for joining us. I'm Ryan Aroni, the President and CEO of United Way of Greater Lorain County. And I want to thank you all for joining us live here on YouTube. This is the fourth community chat that we've hosted here. And we're really excited for this one today to talk about transportation here in Lorain County. We'll be talking to the Lorain County Mobility Manager, as well as our friends and partners from the Nord Center and the Licata Way to learn more about transportation as it relates to solutions that we're providing and also the barriers that we still need to address together as a community. If you've tuned in to United Way's Homecoming Week this past October, you would have seen that transportation was constantly and consistently named as one of the biggest barriers that our community faces from local leaders that we interviewed all across Lorain County. And from a United Way perspective, much of the work that we're doing really focuses on the barriers and the disparities that result in our community due to a lack of reliable and adequate transportation. For me, I think anybody who's ever heard me talk about transportation knows personally I'm very passionate about this. As a kid from Oberlin who, my family didn't have a lot of money and I didn't have a car, Lorain County Community College was the best option for me to go to college. And I was able to ride the bus to get there. And I was able to catch it really early in the morning to get to campus in order to have an on-campus job and to work before class. And even with extracurricular and playing baseball, I still had a bus that could get me home late at night. And unfortunately, that route doesn't exist anymore. So a kid like me who doesn't have a car and doesn't have a lot of other options probably isn't going to college right now. And I really credit that for even giving me the opportunity to become a college graduate, and it doesn't exist anymore. And that's just school. We know it relates to work and healthcare and social services and seniors and people with disabilities. There's so many other layers to this that we're going to talk about today. So thanks again for being here. I'm going to introduce the folks who we have here and ask them to tell us a bit more about themselves. And I'll start with Sharon.
Hi, I am Sharon Pearson. I am the Lorain County Mobility Manager. I have been involved with transportation for 12 years, but just started as Mobility Manager in January at United Way of Greater Lorain County.
Thank you. And we'll go to Dan.
Hi, good afternoon. Dan Haight, President and CEO of the Licata Way. Been working with transportation probably for close to 15 to 20 years and really helping the behavioral health community mainly and writing grants to help get transportation for those people.
Thank you. And Ruby.
Hi, I'm Ruby Foster, and I work for the Licata Way. I'm the transportation supervisor, and I've been working for Licata for about 15 years.
Great, thank you. And Don?
Hi, good afternoon, everybody. My name's Don Schiffbauer. I'm the CEO over here at the Nord Center. I've worked in healthcare for a number of years in Lorain County and can attest to the issues the county has had regarding transportation, and I'm thankful for everybody on this call to help contribute to solutions. We were on a pretty good start prior to COVID, and I'm looking to get back on track, tongue in cheek, or pardon the pun. So thank you for participating or letting me participate.
Thank you. Thanks for being here. And Franca. Franca, are you there?
Well, while Franca may be having some technical difficulties, Franca is our manager for client access services. And actually, she'll be the one doing the most conversation for the Nord Center. I told her I'm here as unconditional support, and she's been working closely with our transportation colleagues within the county to facilitate adequate solutions for the clients and community that we're serving. And I'm sure she'll be able to join here in a little bit.
Thank you. So we'll get right into this. I think we all know Transportation is a large concern for our community, as has already been mentioned. I'll just ask each of you to go around and briefly share the impact of limited transportation from the perspective of the work that you're all doing. And I'll call each of you so we can go around the room. So Sharon, I'll start with you.
Yes, thank you, Ryan. So in 2018 and 2020, in fact, this just past fall, we conducted a transportation needs survey, and we found the same thing, that half of the people that responded to that survey have no idea what their options are as far as transportation. What we've also found is that the top kind of needs, whether people have a car or not, what they need to access is food, medical appointments. They want to be able to socialize. And we also know that workforce is another issue. So if half of the people don't even know what those options are, they're not meeting their daily needs. And it's a struggle for them. But that's the reason why we have a mobility manager, to really address that issue and really to make people aware of the options that exist within Lorain County.
Thanks, Sharon. And I'll pose the same question to Dan and Ruby from the Licata.
I'll start off a little bit, and then Ruby will be able to probably give us some great personalized stories from customers we serve. But basically, going back to behavioral health care and addictions in particular, what we've noticed is that 40% or more of our no-shows related it to the fact that they didn't have transportation. So they weren't able to access services based on the fact that they just couldn't get there. And so not having them being able to access services just extended their circumstances, extended what they needed to do. So the need had grown. And I think when I first started Licata, we had like four vans or so. And from there had gone, now currently a fleet of 14 that currently serve the community. And not just to get them to treatment, it also takes them to many different places, whether that's the Job and Family Services to renew Medicaid, whether that's to their physician, whether it's to the Nord Center to see their services there, or even sometimes we take them obviously to get their medications, or to the pharmacy or food places that they need to go. Ruby, do you want to add anything to that?
I just know that a lot of the clients that we transport, they have no other means of transportation. So to get them to what the sources they need, they rely on us a lot to get things that they need. And Dan did say a lot on the medications. Sometimes we do a doctor's appointments. And right now we're also helping United Way with the seniors, grocery trips in the morning to get them back and forth safely. So, with all the pandemic. So there are so many people that need the resource of transportation, and it's not available to them. And it's nice that the county has something to help these people that need this help. So, and a lot of years I've put in and seen a lot of clients, and I've helped a lot of clients get to things that maybe I shouldn't have, but I'll go the extra mile to make sure that the clients get the needs met for the transportation to get them where they need to go. So
great, thank you, Ruby. I appreciate the answer and more, and especially the effort and the passion and the work that you do. So thank you. And I'll pose that same question now to the Nord Center.
Sure, Ryan. Hey, so as we've all got pretty adept at troubleshooting Zoom, I've actually patched in Franca through my cell phone, and she's on speaker. So if I can ask you to just restate that question for her.
Sure. Thanks for figuring this out on the fly. We're just asking each of you to briefly share the impact of limited transportation from the perspective of your agency on those that you're serving.
Okay, and I think that it goes along with what Dan and what Ruby has shared. It creates such a barrier for individuals accessing services. It affects our clients getting the services that are needed, and obviously impacts revenue for the agency with individuals missing their equipment due to not having the transportation that they were counting on.
Yeah, the other thing I'll add on that, and Dan can attest to this, and so can everybody else on this call, there's already a stigma associated with whether it's substance use or mental health issues. The last thing we need is one more barrier to that supports that stigma. And again, we provide quite a bit of transportation in both of our agencies, and we welcome the efforts that this group has put forth. And I know Franca talked about revenue, and while we want to make sure that there's access to services, we also know that it does take us a certain level of income to be able to provide services as well. So it's about access to care, and then the ability to make an organization sustainable too. So.
Great, thank you. Really diverse set of answers there, but all totally aligned. So I appreciate that. Next question, I'll just direct Sharon to you. You've been working on surveying the community about current transportation needs as part of your preparations for the 2021 Coordinated Transportation Plan. Can you tell us what is a coordinated transportation plan, and why has it become a critical piece to improving the transportation in our community? And you're on mute, Sharon. We're working our way through Zoom bingo here.
Yes. So the Coordinated Transportation Plan is like my Bible. It is a guide for helping to address the needs that exist within Lorain County. In fact, before the mobility management person can even be hired, we have to have a plan. And that plan is a community plan that it has data on who are the seniors, people with disabilities, low income and workforce that exists. What are those needs? That's why we do the transportation needs survey to find out where do people need to go? What are the priorities? And then we set aside, or we establish 5 goals that we want to accomplish over the next 5 years. And so that's what we use to guide the work of the mobility manager. And then a mobility manager is hired, because we get 80% funds through the state and 20% local to hire a person to coordinate all these efforts. It's also really about collaboration in Lorain County too, which is one of the things I love the most. It's about thinking outside the box in order to solve these issues. As many people addressed, even though I said there are a lot of more transportation options out there than we realized, we still have a huge struggle, especially when for our rural communities, any place outside of our urban centers and workforce. Those are really big struggles that we have in Lorain County. The other option is, or what else comes with the coordinated plan, is the fact that nonprofits like Nord Center and Licata Way are able to access funds to pay for vehicles at up to 50%. And then the mobility manager can utilize those vehicles as needed to develop a network of transportation systems, like we've done with Licata Way and the senior shopping program that we have going on. It's not something you do traditionally. We had to think outside the box to do that, but it worked, and it's laying the foundation for more work that we can do to solve these issues in the future.
Thank you, Sharon. I think that's so interesting for me, and I shared my story. When I think of transportation, I think of public transportation. I took the bus. I remember accessing the transit to go downtown Cleveland, and that's a part of it. But there's so much more to it. There's active transportation, and there's leveraging the vans that are available, and that's really the idea of this coordinated transportation plan. Taking the resources we do have, coordinating them and aligning them, and then how do we fill in gaps to make it more realistic, that you can easily move around the community. And I think it's important too for us to give credit to Move Lorain County, that has been an advocacy group really leading the coordinated transportation plan that then led to us being able to bring the mobility management program here to Lorain County. So the next question I'll address to the Nord Center and ask you to tell us a bit more about the circulation program at the Nord Center, and what are the goals of that that you've been able to accomplish so far.
Okay, so circulation is a platform that allows us to schedule transportation with Lyft in advance, and then the ride request is sent to local Lyft drivers at the scheduled date and time. Circulation also offers analytics on the ride data that includes to see where people in the county are needing rides. I know that's what many of you have been interested in. Our goal was to be more efficient in scheduling transportation for our clients, and it did just that. The site is really user-friendly and saves rider information with rider preferences. So scheduling is quick, and it has eliminated the address entering errors that we saw when we completed vouchers for each ride that was scheduled. We began using circulation in February 2020. And then, as you all know, COVID hadn't really changed what we do. We have very few on-site appointments now, and with that, we're not scheduling nearly as much as when we began the pilot.
Great, thank you, Franca. And while I'm giving recognition, I'll give recognition to the Nord Family Foundation for sponsoring that pilot program as well. And as you mentioned, COVID has changed everything. So I think there was some really good early learnings in that pilot that we can continue to use, hopefully as more in-person starts to come back.
And Ryan, the other thing I'll add to that is in that February was a couple of months after I had joined the Nord Center. And one of the things, and I remember having a meeting with Sharon early on as well, as, how do we tell the story of success of this program? So one of the things and Dan mentioned this earlier when he was talking about, are the failure to keeps or the no-shows. And there was a palpable or recognizable impact on the failure in a very short fashion too, in a very short time frame. Usually you got to give the engine a little time to warm up, but as soon as this program was put into place, we saw our failure to keeps as transportation availability went up, failure to keeps went down. So there was an indirect proportional relationship, but it was noticeable right away.
Thanks, Don. I appreciate that. So next question we'll address to the Licata Way. And your team's been working on a pilot that's actually been mentioned. Ruby mentioned it early on, as did Sharon, with senior apartment complex in Lorain. Can you tell us about that project, and then what are the goals that you've been able to accomplish so far?
I'll let Ruby explain. She was working more intensely with that one. I just set up the meetings.
The program is with the pandemic, we try to make it more safer for the seniors and make sure that the seniors can get to the grocery stores and get the essentials that they need. The hours are not that great, so the seniors, I don't think, like getting up so early in the morning, but as they do appreciate it. The drivers really help the seniors get into the stores, get the things they need, get them back to their apartment, and help them get the groceries inside. So the drivers do a lot to help the seniors, and it's a very good program. We just have to get the seniors to initiate to want to come and use that program, because I think it helps them in the long run to see that there are ways that they can get the services that they need to help them.
And to add to that, I mean, this was a perfect example of collaboration. I mean, you get a call from United Way and they ask, hey, what about this? And I said, well, right now we are not transporting anybody. We have, umpteen van drivers. Right now we turned into basically, I call them COVID cleaners, because basically they're walking through our buildings 3 times a day, cleaning every service possible. And we've talked to Ruby about this before. Where can we fit in these extra rides for other people besides our customers, and what does that mean, and how can we do it? And Ruby's always been an advocate for providing, help to people for transportation. So having that right mindset to be able to just jump into it and say, what, let's try it. What the heck? Will lead us into more things, as long as, people don't put themselves in silos and say, this is only for us. This is the only way we're going to do it is for me. It needs to be a we thing, and that's where our community needs to come together for this stuff.
Thank you. And it's interesting, we talked a bit about the coordinated transportation plan, and those were 2 great examples. The circulation was utilizing Lyft and software program to help make connections. And then we were also able to utilize vans, Licata vans that were available. And so just perfect example of taking resources that are already there and plugging them into a coordinated plan. So the next question is for everyone. And obviously this year has been challenging for a whole variety of reasons. We've had to completely change how we engage and serve our community. How have you and your teams adapted this year to continue serving people amidst the COVID-19 pandemic? And I'll leave it open and you all can jump in as you have an opportunity.
Well, I can go ahead and start. I want to follow up on the whole senior transportation pilot. As I said, I've been in transportation for 12 years, but just started this position as mobility manager in January. And it's a different type of position. There are over 39 mobility managers like myself working in 65 different counties throughout Ohio, but none of our jobs are the same because it's really about the people and the characteristics of that county that we need to work on. And so coming at this and using the coordinated plan and looking at all of this, my job was really to go out, build relationships and do all this. But with COVID, when COVID came along, I had to put a halt to everything. And really, it allowed me, I think in a good way, to really focus on what are the goals of the plan? What is it that we can do? And when I, working with the Office on Aging, heard that there were some seniors at a senior facility that weren't getting any visitors and weren't able to get out to get food, that's when things started kicking in. Hey, look, this is the perfect time to start a small pilot to see how this can work. Because if we can do this in a small way, we can do this across Lorain County. And it's been very good, very successful, and it's laying the foundation for further collaboration that I think is going to make a big impact in the future. So I'm very excited about the opportunities, and in a way, having to focus has been a blessing in my belief, because we have started 3 pilots this year, which I know a lot of people haven't heard about, but that's because we're trying to test this out to fully understand what it is that we can do to grow this in the future.
So to add to that, one of the things, I mean, we still will offer a one-on-one or sort of underneath the health department's guidelines, transportation to appointments for our residential women that we continue to serve face-to-face, and occasional appointments like that. One of the things that I just really haven't really talked about right now is the transportation to jobs. And it's one of the things that, I tried to work with pre-COVID. I was trying to work with the city of Elyria. Because we have a lot of our customers who come through us, typically the ones that come back to us, we ask them what happened. And 9 times out of 10, it was usually something to do with employment. They couldn't sustain it because they couldn't get there in time. They couldn't go there. And, just thinking about, where I lived in Grafton Township, there's no public transportation. There's no possible way that I would be able to get to a job unless I had my own, car and money for gas and those sort of things. But most of the time, our customers that are trying to succeed, they get to that point where we're ready to let them get back into the community, get a job, get what they need to do, and they hit a roadblock. They can't afford a car, they can't afford the insurance, can't afford everything. So they're out there, they're trying, but they got to hit that roadblock, and we need to provide something that will help them succeed to be, partners in this community again.
Yeah, this is Don from the Nord Center. So one of the things as a provider of healthcare services, our organizations were able to pivot pretty effectively to telehealth options. Telehealth in a way did help mitigate some of the transportation issues within the county. However, in a standalone environment, it's not powerful enough to mitigate everything. I think if you combine a telehealth environment with a program like Circulation or the pilot program that was being part of the Licata Way, then you really get some critical mass and you're helping to support a good amount of access to services. But Dan brought up a very good point. We were very adept at being able to provide behavioral health and SUD services, but that's not all the community needs. They need transportation to jobs. Dan's organization, our organization, and other ones out there have a finite supply of vehicles and people. And hopefully what this pandemic will come out of it through a hot wash is how do we maintain access not only to healthcare services, but also to the basic needs such as food, shopping, employment, socialization when appropriate. So very good point, Dan. I appreciate you bringing that up.
Thanks, everyone, for the answers. And we actually have a question that's come in from the audience, and I'll share that. And it has to do with circulation. I think I'll start sharing with you, and the others can jump in as they have feedback on it as well. But the specific question is, how are the lift costs covered using circulation? And the second part of that question is, does the program work with food delivery at all?
So some of this NORD Center may have to also answer, because NORD does have some funding for those special situations for transportation to pay for that. But there is a service fee for the technology piece using circulation, which is at $4 a ride. So it's your normal Lyft charge. So if somebody were to use Lyft, it's the same charge that way, but there is a $4 an hour fee or a charge, and that is what the Nord Family Foundation is paying for to assist us with this pilot project. But I don't know, Don, if you want to answer about.
Oh, I'm going to turn it over to Franca.
Okay.
So the Board of Mental Health, formerly Lorain County Mental Health Board, now the Mental Health Addiction and Recovery Service Board of Lorain County, provides funding to network agencies in order to provide transportation for clients to get to their appointments.
And so essentially, if I'm interpreting this correctly, there's a normal Lyft charge, which is covered through funding from Nord Center or the provider. There's an additional fee that is to use the program and the software, which for us locally has been covered by the Nord Family Foundation as part of the pilot. To answer the question about food delivery, that hasn't been part of this. There are other examples of using rideshare services to do food delivery, and that is to be determined. That would be something else that we're looking into. It's not exactly a part of circulation, but there are opportunities out there to do that. So I'll move into our next question. Again, for everyone, how do we all, as members of the community, myself included, and the people who are watching, how can we help, and how do we get involved in this work?
Well, I can start off again. As I mentioned, 80% of our funding comes through ODOT, which is actually through the federal government to support the mobility manager doing this coordinating work of transportation. There's 20% that needs to come from the local community. And so I know United Way has a special way to donate to continue to support this work. In order for us to pull down that 80%, we have to have that 20% match. And we have a total of, we've budgeted $100,000. 80,000 comes from the government. So 20,000 is what we need to raise to continue this program. Also, we encourage you to participate in the Transportation Advisory Committee meetings. I know Ruby and the Nord Center, everybody have participated in those meetings in the past. Keep everybody updated on what's going on. So that's another way, because this is not my program, this is the community program. And so we need people to be involved in hearing their voices and working alongside of us to advocate for what we need here in Lorain County. We also encourage people to like our Facebook page. They can go to moveloraincounty.org. There's transportation options listed there. They can sign up for the e-newsletters. And most importantly, right now, we're in the midst of updating the coordinated plan. I'm looking to have those updates by Monday at 5 o'clock. So we encourage people to go to the moveloraincounty.org website, take a look at the coordinated plan updates, give me your feedback on that. And I would love to incorporate that and get that sent in to ODOT for their review. So that's it. Thanks.
Certainly say advocacy is probably the biggest thing, and talk about a community-wide need. Advocating it with your representatives, senators, et cetera, to take a look at communities such as Lorain County, who has huge diverse populations in urban and rural areas, et cetera. We're not a Cuyahoga County where we have to throw an RTA and we can go street to street to street and have plenty of people riding every day. There's sometimes that LCT, I'm sure, has one person on the bus and they're riding 20 miles without picking up the next one. It's not going to be sustainable that way. But that need, that one person who got to that job or got to that area of need is there. For Licata Way, 20% of our funding we get from basically from the ADIS board, or formerly ADIS board, now it's Mars, through state grants. And it's only specifically for women, and then women and children. The rest of the money comes from donations. So we come up with another $100,000+ just out of donations and our bottom line. So there's more to that obviously than just that. So there's plenty more things that go into it. But so if you do make a donation to Licata Way, you know that some of that money is going towards transportation. It's going towards treatment. It's going towards things that we do. But I would certainly say bottom line advocacy. Let's get the ball rolling that way first, get a funding stream that's going to be sustainable for the future.
Yeah, Dan, because we're not a Cuyahoga County, it really relies on a grassroots effort. And I think to the person that posed the question on the YouTube channel, it starts with supporting organizations like the United Way, or the Licata Way, or the Nord Center, or the Genesis House, or Let's Get Real. There's a lot of agencies out there that rely on transportation as part of their ability to deliver services. And Dan, I'm gonna speak for you a little bit, but you can correct me if I'm wrong. If you send a check to the Nord Center and say, hey, I only want this to be used for transportation for our clients, then it's only going to be used for transportation for the clients. And I would assume the same thing can be done to other agencies. So we know that there is a heavy lift for a global transportation solution for the county. But if you're looking to make a difference right now, supporting these programs, whether through the United Way or using the United Way as a vector to other agencies like just the two represented here, we would make sure that those funds were directed towards transportation efforts.
Thanks. And yeah, I echo that. We've shared in the live chat a link to donate to United Way to support the mobility management program. As Sharon mentioned, the 20% of the cost of the program is United Way's commitment to raising those dollars. And as people donate through their workplace campaigns, they can designate or direct to mobility management. But everything you said, Don, it takes all of us, and there's no such thing as a bad donation. A lot of really good causes and great organizations out there, and it takes all of us to do this work. So we actually had another question come in, and it's related. It's how can local businesses whose employees might lack reliable transportation and they want to help, how do they get involved in the coordinated plan?
Well, that's funny that that question should come up, because I have been thinking that I know workforce transportation is such a big issue. I'm considering developing some type of committee to just talk about that. Some of the other work that's going on is there is what I would call a pilot program called the Paradox Prize out of Oberlin that is focused on getting people to work. Oberlin had a 2-day-a-week service with Lorain County Transit. They're going to move that to 5 days a week service starting in January. So we need to look and see how that goes and really advocate and support that work. Also, I am working on an employer transportation toolkit to help employers identify what the options are. There are options out there. There is even federal assistance out there. And I'm finding that most employers don't even realize that. So I would encourage anybody who's interested to get in touch with me at United Way. And I would love to chat with you more about what those options are and the work going on around workforce transportation in Lorain County.
And I'll echo what Sharon said. I mean, getting in touch with Sharon in terms of coming up with a plan for the community is certainly probably the best thing. Some of the ideas that I've seen out there people talk about is making sure businesses are open to not the normal, right? So if everybody started their shifts at different times, there's no way that transportation is going to be able to route to every single one of those. So open that up and saying, okay, I want to have my shifts 2 to 7, and guy down the road is going to have it 2:30 to 7:30, so that you stagger shifts of transportation can be an option. So you can get employees that are going to be coming to work on a regular basis. So really thinking outside the box with, not just yourself and your business, but how can you operate in the community that will support people that will be able to get to your business to become successful employees.
Thank you for those answers. And I'll go to the last question that I have, unless we have any more come in. And it just relates to the end of this year and plans for the start of 2021. What do each of you and your teams have planned to continue improving transportation options in Lorain County? And I'll go around the room. I'll start with you, Sharon.
Well, I kind of have two. I mentioned the one, workforce transportation is going to be high on the list for 2021. From my understanding and talking with people, there are a lot of businesses, despite this pandemic, that are actually growing. We have the new Carvana coming in that's looking to employ lots of people. And I think it's important that we make sure that people from Lorain County are at these jobs because that place is located right off of 90. So it's easier for somebody to come right from Cleveland and get those jobs. But we want to make sure people from Lorain County get those jobs. And so it's very important that we advocate and support transportation, workforce transportation in Lorain County. The second thing is taking what we've learned from these pilot projects with both circulation at the Nord Center and the small pilot we've done with the seniors, and taking the learnings from that. We're working on a third one with Life Care Ambulance to develop a network that will enhance or support the transit system we have that can address all of these issues. Now, it's going to take some time, but that's what we're looking to do, is to expand these and grow these pilot projects that have been successful.
Thanks, Sharon.
Yep. Go ahead, Franca.
One of our problems with using the circulation platform was the availability of Lyft drivers. So even with our very limited on-site appointments and even fewer requests for transportation, we had problems finding a driver that was available to accept the ride request. So with Sharon's recommendations, we are piloting that new transport system with Life Care. We believe that using Life Care to transport will be much more reliable, and we won't have to scramble to find alternate rides in order to get clients in for their appointments or be given a ride home. So we look forward to working on that.
And it's probably best that I don't get involved in the minutia of the operations. However, what I will, to your question, Ryan, about what can we do to support this? You heard me talk about earlier, when we started circulation, what's some measurable data that we can use to support the sustainability of these programs? So whether it's with Life Care or circulation or Uber or Lyft or something that we grow internally, making sure that we've got a data collection process that we're able to tell the stories to the utilizers of the service, potential utilizers, potential funders, so that they can see that the work that we're putting towards to mitigate transportation issues in the county, whether it's for the Lacataway, the Nord Center, or for any type of manufacturing job within the county, that there's data to support, because it's hard to argue with data. And you can give a lot of subjective information, but when you see the trends going up, when you see the failure to keeps go down, it really does provide a glaring support for those initiatives, and hopefully one's support enough that people can get behind.
So Captain Lacataway, I mean, basically, we're kind of stuck in a hard place right now. We've got the health department, telling us we can only transport 3 people in a 15-passenger van at one time. And even with COVID spiking, that's still risky. So, really the rest of this year into next year, we're really going to probably be working with Sharon to really talk about this new program and see when, eventually when we get to that point, how can we be a part of it? How can we utilize this to help the community? And really just be kind of open eyes, right? Open our opportunities for creating a better solution.
Well, great. Thank you for all the insightful answers. We really appreciate the time from all of you and from everyone who joined us live on YouTube. Just a genuine thank you to each of you as our partners in doing this work. Not only in transportation, but what you do every day with the missions of your organizations. Lorain County is a better place because of your organizations and each of you as individuals. So thank you. And that's all we have for today's community chat. Thanks everyone for joining, and we'll see you next time.
Thank you, Ryan.